To be
Are you?
honest, can anyone hear me?
Yeah,
Oh,
it's fine.
okay, yay. All right, okay.
Okay, your mic is now working. Good.
Yes,
Uh,
finally.
okay, so you can see. Can you all see the document?
Yeah, yeah, can
Yeah.
see.
Yes.
So this is just the formality, the MQA purpose thing. So in this class, I'm planning to take these drugs: Collinsonia, Condurango, Corallium rubrum, Cratageus, Crocus sativus, and later I added Eupatorium also to that. So let me just add into it. Materia Medica, when I made the notes, I always felt very comfortable using this Word document rather than the PPT. So for Materia Medica, the notes that I prepared, the first 18, it is in Word document. So these are the six drugs that we are going to deal with today, and the first one is Collinsonia canadensis. So before we go into, uh, have you heard of Collinsonia? And of course, some should have prescribed it. Can someone say me anything about Collinsonia? No one is talking.
Just heard only while going through other drugs. Didn't
Okay, what
study.
did you what did you hear?
Huh?
I
Sorry?
mean, at least in which drug comparison did you hear?
Hemorrhoids.
Yeah, hemorrhoids. Yes,
Yeah, with constipation maybe,
yes.
or any symptom alternating, but also concomitant with hemorrhoids. It's a small remedy, as I know.
Yes, yes.
Yeah.
And also there can be some heart problem in case of Collinson. So the
Yeah, the
common name,
bleeding hemorrhoid, right?
yeah, bleeding hemorrhoid. So in case of Collinsonia, the common name is stone root, and the natural order is the family is Labiaceae. You know the importance, of course, you should be knowing it can be asked for MCQ, one of it. So this is actually the preparation is from the fresh root, the tincture. It doesn't matter, but this is what that we use the Collinsonia root for the preparation, and this is the plant. So clinically, what we use is this for hemorrhoids and heart complaints, and the keyword if to use over here that will be congestion and congestion. Another drug, do you remember what the keyword will be congestion? How many drugs are there?
Congestion?
Hmm. Congestion means
Melatonin?
just the flow of blood to some particular organ. It can be to abdomen, it can be to the pelvic organ, it can be to the head even. So what you told was belladonna, right?
Yeah.
Yes. And anything else with congestion as the key term? It will be another one, aconite condition. But the most important, if we go to chronic, but it can be given for acute complaint also, will be sulfur. Sulfur also, the congestion is very important. When we go for the sulfur, we know that the face will be already that reddish appearance because of that congestion. And they have sulfur is also indicated in abdominal congestion. So the same thing, but a small remedy that is called insomnia. So here we have, as we see in sulfur, the abdominal congestion. Here also in collinsonia, we have the pelvic and the portal congestion. So the pelvic congestion will be related to the organs in the pelvic area, the reproductive organs of the males and females concerned, bladder, etc. And then The portal congestion will be related to the portal vein. So ultimately, it can lead to a congestion descending downwards, leading towards the rectal congestion, that is the hemorrhoids. Or if it is moving ascending up, it can even result in some complaints with the heart. So here the congestion is pelvic and portal, resulting in dysmenorrhea in females and also in hemorrhoids. This pelvic viscera congestion leading to hemorrhoids, and that is mostly seen in the latter months of pregnancy. So in the latter months of pregnancy, when even the abdominal that pressure is increasing, the portal vein will be getting physiologically congested at that time. So if a pregnant lady is developing hemorrhoids in the latter months, then Collinsonia is a very good remedy. And if the congestion is moving towards ascending, there can be cardiac complaints and resulted dropsy also. There will be palpitation uh, in patients subject to piles and indigestion. So kind of uh, typical, what is that, a kind of rhythm, I don't know how to say that, 3 points we can bring over these people who are having heart complaints plus indigestion, complaints of indigestion plus hemorrhoids, we can think about Collinsonia. Heart action is persistently rapid but weak. So it will be a palpitation is there, but a weak, a kind of the heart trying to be compensatory mechanism, but still it will be very weak. So heart complaints with indigestion and hemorrhoids, a small remedy can be Collinsonia. But if you're going for other type of remedy, this one sulfur will be a good prescription. Heart indigestion and hemorrhoids. Another one will be lycopodium, but lycopodium will be more towards indigestion and hemorrhoids. Heart complaints we don't usually learn in lycopodium, but if the constitution is matching, obviously, of course, heart indigestion and hemorrhoids, lycopodium can be anything else. And any other medicine it is which is coming in your mind where these three things might be involved: heart, indigestion, and hemorrhoids?
If it's just indigestion and hemorrhoids, Nux vomica can also be used, right?
Yeah, Nux vomica also. But as I told, because Nux vomica is similar to lycopodium, we have the constitutional remedy. So in case of constitutional remedy, for that in case of constitutional remedy, when we take for the essay, usually what we follow is a boric or the Allen skin. Not we can't
Mhm.
by study and by heart all the other remedies. But if we are going to take head and spreading symptoms, of course we are going to find some of the other symptoms under Nux heart also, even Lyco heart also. But we are not studying that deeply when we come into this, these concise books like Bodic or this one. Even Bodic, there will be some things. But when we are trying to remember, it is not possible for us to study. So Nux vomica also a constitutional. If we are getting the constitution and the heart complaints are there, of course we can think about. And Nux form, there are more probabilities because he will be a person who is going to do all the substance abuse. He's a smoker, he's an alcoholic. So even Nux can come over there. So let us just put in over there sulfur, Nux form, lycopodium, and another one, Aeschylus. Have you studied Aeschylus? Come on, all of you, please keep your mic open. I don't want even Materia Medica class to be so monologue. Anything else? Okay, fine. So this can be asked like a MCQ. After heart complaint is relieved, old piles reappear or suppressed menses return. So after heart complaint is relieved, when that is suppressed, one of the complaint is relieved, either the hemorrhoids or the suppressed menses is returning. So this is a good MCQ question also. And the piles, the hemorrhoids, as already Lenny told, it is actually the bleeding piles, the bleeding hemorrhoids, and they have the sensation as like in Aeschylus itself. In Aeschylus also there is a sensation of something stick or stone or a gravel had lodged in the rectum. So that sticking pain or stones being lodged over there, that sensation is similar in collinsonia. Then along with the hemorrhoids, it can be dysentery or alternate constipation or diarrhea. I mean, all the three are possible. The three types of bowel movements, everything is associated with the hemorrhoid. And obviously, as the common symptoms say, if there is dysentery, there will be associated tenesmus also. In pregnancy, we saw that in the latter months of pregnancy, if hemorrhoids is appearing, collinsonia could be a remedy. And collinsonia is usually given in a low potency and also tincture, okay? Not in a very high potency. So if in the earlier months or during the duration of pregnancy, if the lady along with the hemorrhoids, if she is having pruritus, then collinsonia can be. But hemorrhoids, if it is protruded outside, obviously it's a common symptom to have itching or the pruritus. But pruritus with hemorrhoids during pregnancy, collinsonia. Now, another important symptom, which usually acts as a MCQ, but also in a clinical indication, this is another symptom, constipation of children from intestinal atony. So whenever there is a intestinal condition in which there is no movement of the stool, like intestinal, that tonicity have been lost in case of infants or children, and that resulting in constipation, we can think about collinsonia. But there are other remedies. Can you say me some constipation of children from intestinal atony?
Nux vomica again.
In Nux vomica, it is never constipation, Vinod. I mean, in Nux vomica, what we say is actually ineffectual urging. We do put constipation, we do put constipation alternating with diarrhea, but always this person will be having an urging. You need to understand why we use that term constipation in Nux vomica. Constipation, as such, by theory, what we say is the stool movement is not happening for 3 days. That is medically considered as a constipation. But that is not the exact condition that is happening in case of Nux vomica. Nux vomica will be always having that urge to pass stool, and they will be passing stool, but it will be not enough, or they feel that still something is remaining. So it is not a complete constipation. We use the term constipation. There is piles also in Nux vomica, but of course it is not a absolute constipation. The stool is passing, but the person is not feeling a relief or a satisfaction from it, so that he always wants to go and pass the stool. That's a kind of constipation over there. But in this one, it is like a calcarea curve, we can say. The patient is not at all passing stool. That will be the meaning coming over here. And anything else?
Alumina.
Okay. Opium?
Yes, opium. Someone told me another medicine. Mine, you told some other medicine.
Alumina.
Yes, alumina. Yes. True. And in alumina, there is a special indication also, especially bottle fed babies.
Hmm?
The bottle fed. No, the bottle fed. The babies who are given the formulated milk. That one. Then this medicine, they also have nasal, gastric, and pharyngeal catara, because most of the hemorrhoid remedies, it is having action on the mucous membrane. So wherever there is a mucous membrane, they will be having some action. And for that, this kind of similar symptom we can see in case of aesculus also. Aesculus is also having hemorrhoids, and also it is having this nasal catara or this throat region or pharyngeal region affections that is seen in case of aesculus also. So similar in case of collinsonia, and usually these things, if you notice that feature, all the medicines, if they are having some action on the hemorrhoids, definitely they are having action on other organs in which the mucus layer will be there. So there is cough from excessive use of voice or minister's sore throat, which means there is a term used in Materia like clergyman's sore throat. So it's just showing that profession. So minister, they will be always speaking, and clergyman is the priest in the church. So the people who are constantly using the professions, who are you constantly using their voice, like the teachers, the ministers, or even the priest, then singers, orators, all these people, they will be having cough from excessive use of voice or the sore throat. And there are lots of other remedies for this condition. Can you say me some? Yeah, I will like say.
Is it Hepasalf? Is it?
Apart, yeah, you can go for the hypersensitiveness, the cold. Yes, there is the hoarseness if there is, but that should be with much pain. Painful it should be.
Okay, that's what.
More than Hepasal. More than
Some
Hepasal.
agentum something.
Yes, Argendamet. Argendamet. Even Argenta nitricum also has got, but Argendamet. Then there is another one with the A itself. Someone help me to remember this one. It is always having a tendency to constantly pick their nose. This is that remedy with A.
To constantly what?
Constantly
what
pick
is?
their nose. Pick their nose.
Oh,
Oh, pick the nose.
Aaron Trifler. Yeah, have you studied this Aaron Trifler? Even this one is having
I think Sina also have.
Huh?
Sina.
Yes, Sina, but it is usually because of Sina is also constantly picking, but Sina's picking is due to because of worm complaints. And iron trifilum, they don't have the worm complaints because, but it is because of the this affections of the nose and the throat, and the discharge coming will be too irritating, and they will constantly pick the nose to scratch it, to itch it until it bleeds. Aaron Trifellum, if a baby comes to you and you see, because Sina is never going to do like that much that the nose start bleeding or the bleeding discharge will be over there. No, they're just constantly doing like this. If you can see my action, they just do like this thing only. They're not going to put, or maybe inside, but not going to hurt themselves and make this blood to come outside. But iron trifilum will be like they will be constantly picking because of that nasal discharge and that constant irritation, and then they will scratch until the blood comes out. So when we see the baby will be actually having the discharge mixed with blood. That is iron trifilum. So it is also having. Then our other medicine will be Drosera, even Spongia. Stop over here. If there is any medicine that I have not mentioned but you feel, just say okay. Said to be a special value when given before operations for rectal diseases. It should be, I have taken it from J.H. Clark, but I don't know why it is being told like so. The aggravation, the slightest emotion, mental emotion or excitement can be aggravation, as like in case of addendum nitricum. You can also have that. So many other remedies. In relationships, it is an antidote to nux vomica. And there is another important sentence in case of collinsonia and nux vomica. I hope you understand the importance of this sentence actually. It's cured, a small remedy, curing colic after colocynth and nux vomica had failed. So whenever there is a colicky pain, the first remedy that we think about is colocynth actually. So after colocynth failing, and then even nux vomica being failed, collinsonia has cured colic. So that sentence is very important. And another one is in the collinsonia, though we say it is a small remedy, in the relationships we see that after some common remedies, like in case of colic, after colocynth and nux vomica had failed, this has been successful. And in case of heart diseases plus hemorrhoids, the type of constitution that we are saying about, not the constitution, people who are having. So we can go for collinsonia after cactus and digitalis has failed. So that is about collinsonia, a medicine which is mainly for hemorrhoids, bleeding type of hemorrhoids, and also associated cardiac disease. So heart, indigestion, and hemorrhoids. Can be associated with the hemorrhoid complaint in the pregnancy, especially latter months, and there will be pruritus, alternate constipation, diarrhea, or even dysentery with tenesmus. It's the main symptoms. So, put in short, it is the heart, hemorrhoids, and also indigestion. The second one is Condurango. Scientific name is Gonolobus gondorango, the common name condor plant. And natural order of family is Asclepiadaceae. It's seen in Ecuador and South America in the high altitudes. Preparation, we use the tincture or trituration of the dried bark of the stem. So this is the plant and this is the bark that has been used. And you know the condition, even that is a small remedy, Condurango. You know the condition in which Condurango is usually used? Anything, any idea? It is a good remedy for cancer. One of the small remedy for cancer, the cancer pain, and especially of this area, the oral area, the tongue. It can be given to any organ, intestine, anything, but mainly the oral region. So the cancer of lips, tongue, inside the mouth, all this area, it comes under Condurango.
Hey, miss, is this the one with the cracks?
Yeah.
The sides? Oh, okay.
The crack is very characteristic of that. Then, so the CA breast
epithelioma, rodent ulcer, the tongue, lips, stomach. Though all the things comes up, mainly the CA lips, CA tongue comes under Condurango. Can be also given for the varicose ulcers, lupus, stricture of esophagus. The active principle Condurango it produces locomotor ataxia. So Condurango it belongs to the milkweed family that is related to the Calotropis. And Calotropis, the Calotropis when we take that leaf or any part, even if you're going to uh, take the leaf from the stem or if you're going to break that stem, um, a milk discharge will be coming out from that. And if it is going to touch our body, it is going to produce some irritation. And in very sensitive people, it can even lead to a non-healing type of eruptions, going to the level of ulcer. So it is to the same family of Calotropis. Condurango is also belonging. So this one, the action of the latter in syphilitic condition may be compared with the power of Condurango over cancer. So because of this, that discharge or not discharge, I don't know, the fluid that is coming out from this plant, these medicines belonging to the family, the milkweed family or the Asclepiaceae, those medicines usually have good action on the skin. So in case of Calotropis, it is usually given for the syphilitic conditions. Calotropis is also one of our medicine and Condurango for the cancer conditions. They have ulcers, which is the Condurango, which is very old, obstinate. Obstinate means never curing or it just heals for a while and then returns back. Foul smelling, ichorous ulcers. Ichorous means the discharge will be very, very offensive, very thin in nature. Um, and for the carcinoma of the lips with an unclean and sinus ulcer. So that will be the usual appearance. That's why we told that it can be given for varicose ulcers. So any type of ulcers where it is very old, obstinate, foul smelling and ichorous, we can think about, and that will be with unclean and sinus ulcers. Sinus means there will be a blind track also from where the discharge is coming out. And when I say this sentence, old, obstinate, foul smelling, ichorous ulcers, you have any remedies coming into your memory for a comparison?
Sulfur kit.
Pepper salt?
More specific?
Nitric acid.
Nitric acid, yes. So now you told sulfur, acid, nitric acid. Nothing more? Can I add? Meserium, mercury, then
Graphitis.
fluoric acid. Graphite is, yeah, it is also offensive discharge. If someone is trying to speak, please. Sometimes I may not be remembering all the remedies, so.
Foul smelling.
Uh-huh.
No. I'm just reading your notes. I'm trying to.
That's what is coming in my memory now. So, as Farah was asking, is this the remedy which is having that crack? That is the indication. Not just the cancer of all these organs, the mouth thing and all. The most important indication, because there will be a leading indication for every small drug, there will be one or two leading indication. So the leading indication for this drug, Condurango, will be a painful crack in the right corner of the mouth. That is the characteristic indication for the Condurango. And this one also, it will also goes to over there, the ruggeds at mucocutaneous orifices, that what we learn in case of nitric acid. The same thing we can see here in case of Condurango. So what Dungeon had told about this drug is, there was a case of breast tumor which was increasing steadily under hydrastis and phytolacca. And phytolacca, we do consider it is one of the best remedy for the breast tumor. But under these two remedies, in that case, it was constantly increasing and it was somehow controlled. A type of controlling was able to be done temporarily by conium, but under Condurango, it entirely got disappeared. So that's the thing that we see. So the cancers originating in epithelial structures. Ruggeds at mucocutaneous orifices. Mucocutaneous means wherever the mucosal membrane and the this one, the skin is joining. So mostly at this nostril area, this oral area, this area, and also the hemorrhoidal area. I mean, not the hemorrhoidal, the anal area. That is the places where the skin and the mucous membrane are joining together. So over there, there can be cracks appearing, that is ruggeds, and also warty excrescence. And then you see this is also the same indication that we see in case of nitric acid. But then in case of nitric acid, how we differentiate is, nitric acid is actually a constitutional remedy. We have a particular constitution. They have that very angry, not just angry like Nux vomica. They go even to the level of attacking the people. Extreme rage, that is what we see in case of nitric acid. And as and as like all the acid remedies, there will be total destruction. That destruction could see like in a syphilitic manner or the cancerous condition when the person has extremely gone towards a bleeding cancerous cactic condition, we can think about. Or sometimes it can be also, you know, I mean, it depends upon people who and how they prescribe. I'm very sure there will be people who will be giving nitric acid as a constitutional remedy or a high potency 3200 and Condurango as a low potency in 3X or 3C. I'm very sure that might be the condition also. Though I don't advise you to do that. It's never homeopathy. Still. Then they're having cutting, stinging, burning, tingling type of pain. And all this burning, when we see cutting, burning, tingling, almost similar to the pain in case of epis. And when we say epis is also having, I mean, it is also a good indicator for cancerous conditions. There also we'll see epis, especially the epithelioma, the epithelial structures. Epis is a good remedy. Then it is a good remedy stimulating the digestive functions, modifies secretion of digestive glands, and thus improves the general health. And this is more related to a cancer patient. A cancer patient during his cactic conditions, and though because we told that this is mainly affecting the cancer lip and the tongue. So maybe because of that, he's not able to eat properly, or when the cancer has gone into its cachextic level, even the digestion will not act properly. The general health of the patient will be affecting. So at that time, Condurango could also be given as a tonic. This can stimulate the digestive function, increase the secretion, and thus improve the general health. It allays or decreases the gastralgia accompanying cancer of stomach. There can be vomiting of food and induration in left hypochondrium with constant burning pain. When we say vomiting of food and induration in left hypochondrium with a constant burning pain, could you say me what might be the structure or what might be the organ they are mentioning about, or what type of cancer when the location is left hypochondrium?
The stomach.
Stomach, yes. Then,
Spleen.
yes. And one more.
Mm.
The pancreas?
The pancreas.
Yeah, yeah. The pancreas too. So
Pancreas?
mainly yeah, pancreas.
All right.
Pancreas, spleen.
The descending colon, the left descending, yeah, the colon.
Colon means it has reached to the other level. It's not in the hypochondria. It will be in the iliac region.
This is the left lumbar region, right?
Yeah. Lumbar and the iliac will be not in the hypochondrium. Hypochondrium, these structures. Okay, so anything, what I just wanted to show you was that mainly the intestine or the digestive related organs, starting from the mouth until the anus, but mostly it will be in the see a lip, see a tongue, condurango. So in the skin coming out from the cancerous condition, because we have already seen that not the distance, the secretion, yeah, the secretion that is coming out from the plant, it can cause the irritation. So they can be given for blotches, eczema, pimples, pustules, indolent ulcer, lupus, varicose ulcer, anything that is syphilitic related, and even the serous type of ulcer or the hard ulcers, we can think of it. Burnett considered as a very strong affinity for the tongue. He had cured with it a jagged ulcer of the tongue. Doubtful whether the cancerous or the syphilitic. The tongue and lips were very red. I don't know about the other symptoms, but however, what they stressed upon is it is, as I already told you, see a lip, see a tongue, Condurango is one of our specific. Then the third remedy is Corallium rubrum. Do you have anything to ask in between? I'm just going on. Anything to ask in between? Talk me over there, okay? Because I really don't know how you might have attended the Materia Medica class of Patha sir or even George Vithalkas who have attended this course, because I'm very sure both of them would be more practical oriented and I'm more theoretically oriented. Like what are the symptoms, more than clinical indications, what I could say is what is being present in the text and the symptoms that you had to write on the paper to get the marks. But sometimes it's not just the clinical indication. There should be some points that should be present to give the mark. So those things are what that I highlight in these specific colors. So if there is anything, just stop me, okay? And much of the clinical indications, I'm very poor to give in that. I don't have much clinical experience also. So it will be very less that I can give you. And even with the very less practice, I've still very less practice with the small remedies. I usually do maximum management with my the common polycrust actually. I very less go for this small remedies. So much of the clinical indications I'm very poor to give. So if you want to add in something, just add in, okay? So the third remedy is Corallium rubrum. Corallium rubrum, it is a good remedy. It's scientific name. Some music is coming up. Oh, I saw her request. It went again. Allison is there, right? The giant.
Yeah, she's in the list.
Yeah, Yes,
So,
just got it.
I think we're all here, right?
So, okay. No, I was getting the tone again that someone is going to join, and your name was Sean Anderson. And after that, when I tried to click it just disappeared. I was just confirming. Okay. So, Corallium rubrum, it is I mean the corallium. So, which means the medicine is taken from the coral. And rubrum is red and it is having some indication. Why I'm saying that rubrum is red, it is having some indication. We'll see when when we go to the therapeutic level. The scientific name is Gorgonia nobilis. It is actually a sea creature. The class is zoophytes. Natural order Gorgoniaceae. Preparation is trituration. So this is our corallium rubrum. This is especially given for corallium rubrum. You know why it is given for what clinical indication? It's yet another small remedy.
For whooping cough?
Yes. Whooping cough or any type of constant type of cough. Corallium is very, very good. So
Yeah.
it can be given for asthma milleri. Asthma milleri, or in other words, it is Miller's asthma. The occupation related, the people who are working in the mines, and also with that fine dust particles that is coming, that related to the people, also occupation related cough, or rather the whooping cough. And it is also having action on the skin for psoriasis, purpura, and also syphilis. So when we come to, that is why I told you to remember the term rubrum reddish. Now when we go towards its symptomatology, we'll see the skin symptoms. It is very much similar to that of the syphilitic ulcer appearance, the chancre, how it changes in the syphilis. The skin symptom is exactly matching to that, or the symptomatology will be going towards that. So never to forget, because we always think corallium rubrum the moment we hear corallium, because we never say corallium rubrum. We always say with the first remedy corallium. And corallium, we somehow get fed in our mind it is a cough remedy or the whooping cough. But if you remember the name completely, rubrum also, then you can connect it with that reddishness and the syphilis, or that what is that, the syphilitic condition or the syphilitic ulcer that is being formed. So indication, corallium corresponds to a combination of syphilis and soda. The constitution will be, it is suited to persons of nervous temperament with nervous cough. And in respiratory complaints, we have the post-nasal catarrh. Post-nasal catarrh means the dropping of that nasal catarrh via the eustachian tube into the oropharynx, and from the throat we can raise it up. So it is not coming from the this one, the lower respiratory tract. It is not from the lung, but from the nasal region itself. So the PND, or the postnasal catarrh, there is profuse secretion of mucus dropping through the posterior nares. The cough is actually of the whooping cough type, which is very smothering, or making the person so difficult to take even the breath. That is the characteristic feature of the whooping cough actually. It will be so continuous, and also the person can't take a breath properly. And there will be a great exhaustion after to the cough. There will be crowing inspiration and sensation as if inspired air was icy cold. So this will be, the two colored thing will be most important in case of the indication, the therapeutic indication for corallium. Most importantly, this one, the air that is being inspired in, they feel it as icy cold. So even in a normal weather, they sit and they're taking air inside, they feel like it is like a icy cold uh, air. And cough in minute gun paroxysm, so that continuous minute gun, or the continuous one, or what we say the whooping cough itself. Whooping cough or any other kind of cough, when the attack comes on, it will be very rapid, and the attack
follow so closely as to almost run into each other. I'm very sure you will understand. You can just connect it with the symptomatology of the whooping cough itself. That continuous cough where the person is not even able to take a gap or a breath in between. The similar kind of cough it has to be. There is much drowsiness with corallium and many symptoms appear during sleep, like lacusis, grandilia. The change of air causes coughing, feels cold when uncovered and too hot when covered. Aggravation during sleep and also after waking up. So in case of corallium rubrum, the thing that you have to remember would be that continuous cough, and continuous cough that which doesn't allow the patient to take a proper breath, and we feel like the one paroxysm has not yet completed, the other one or the other attack has run over to it. So we feel like that because two attacks coming closely, because the paroxysms are soon following each other. And the sensation that the inspired air will be very icy cold, and the minute-gun paroxysms also. Then in skin, as we told that it causes eruption, which are for the most part of its own color, that is the coral red. So you can collect it like that. That coral red color will be the eruptions. However, it will change the nature, and that nature is exactly what we learn if we take the syphilitic ulcer, or not the ulcer, the eruptions that we see in syphilis. When we read through that practice of medicine or the medicine textbook, even the disease, the syphilis, the eruptions changes like this. So the red spots on the palms of the hands, at first it will be coral color or very reddish in color. Then it becomes darker and finally coppery. The chancres to which it corresponds are coral red, or rather the syphilitic chancres. It is the typical feature of a syphilitic chancre, which will be initially when they appear, it is very red in color, and then it becomes dusky, and then like copper, it will be a stale brownish color. So that is a syphilitic eruption appearance, and that same changeability of color or the sequence of color change we can see in case of corallium rubrum also, which means this is a very good remedy indicating for syphilitic eruptions. So from the red, it will move towards dark red and then to brown or coppery color. There will be red flat ulcers on the glands and inner surface of the prepuce with secretion of yellow ichorous discharge. When I say this sentence, you should understand that what we are mentioning here will be a condition similar to syphilis. The red flat ulcers, the syphilitic chancre, it will be usually in the first stage of the syphilis. Now, if you remember, try to remember syphilis, we have the primary, secondary, and the tertiary stage. And the primary stage of syphilis is characterized by the presence or the appearance of that chancre. And that chancre will be in the area where the organism entered. So mostly it can be the penis or the vagina in the case of female, and if it is oral sex, it will be in the tongue area. So here the can be that initial ulcer which is formed in syphilis, it will be actually non-characteristic. It will be non-painful and non-tender. So mostly the patient also will not be knowing about it. So the red flat ulcer on the glands and inner surface of the prepuce, with from that the secretion of a yellow ichorous discharge coming out. So that also comes under the corallium rubrum. So kind of specific. So in comparison, we can keep the specifics like one of the most important, the syphilinum itself, mercurius, rubrum. That also can be kept in the comparison. So this is about the corallium rubrum. Don't forget its skin color, because whooping cough we will remember, then we will remember the other whooping cough related characteristic symptoms also, but we will tend to forget that syphilitic feature. So that is why always corallium, remember it as corallium rubrum. And from that rubrum, the red color, you can connect the skin feature also. So in case of modalities, it is worse in open air, changing from warm to cold room, and relationship in complementary, they have sulfur. Then Cratageus oxycantha, another medicine, small medicine, which is always given in case as a tincture. So this is the medicine. Common name is hawthorn berries, belonging to the family Rosaceae, where we use the tincture of the ripe fruit. Clinical conditions, as you know, it is mainly given for the heart complaints. Whether it's a heart failure or a hypertrophied heart, or for angina pectoris. Angina pectoris, clinically, I'm not sure how much it is going to help us in an acute condition. Acute condition, maybe we have to go for a cactus. But this can be given as a heart tonic. Usually Cratageus, there is a specific feature for Cratageus, like we'll see in the therapeutics, it is very good for arteriosclerotic conditions, or to remove that the crusty deposits, or the arteriosclerotic deposits from the blood vessels. This is very good for that. So like that, individually, if we see the person is having hyperlipidemia or something, Cratageus can be given. For hyperlipidemia, another tincture usually given is Allium sativum. But this one is also very good. But usually in India, what I see is they prepare the patent, the pharmaceutical companies, they prepare the patent with this Cratageus as one of the ingredient in that. And it's considered as a heart tonic. So in case of indication, it produces giddiness or a kind of dizziness, lowered pulse and air hunger, and also reduction in blood pressure. Acts on muscles of heart, and it is a heart tonic, but there is no influence on the endocardium. Can be given for myocarditis, almost all the heart complaints, because this one we usually indication we get from boric. And boric we see only the clinical terms, which is very difficult to remember. But as I told, yeah, the symptoms that we have to remember is this one. It's said to have a solvent power upon crustaceous and calcareous deposits in the arteries. Otherwise, if we go, you can see all the terms, clinical condition that can affect in a heart. We can see that is the myocarditis. Then they say the aortic valve being affected. So those people who might be having this aortic valve dysfunction, incompetence, or regurgitation. So the symptoms related to that, their insomnia, and because if it is the aortic valve that is affected, then the pumping of the blood will not be proper. So there can be anemia, edema, general anasarca, cutaneous chilliness, whatever. Even if you forget to write for the exam, it doesn't matter. High arterial tension, which is high BP. This is a good remedy for high BP. And if we are going for a constitution, though it is not important, it can act as a sedative or to induce sleep, because we already saw there can be insomnia in Crohn's irritable patients with cardiac symptoms. And it won't be like an acute sedative, okay? It won't be like today you give the medicine and today itself the patient will be sleeping peacefully, nothing of that sort, but it is like a heart tonic. So after a continuous usage, though we never say to give this medicine in a continuous dosage also as like a tincture, but its continuous dosage can improve the heart musculature, the heart functioning. So the heart may start to function properly. The pumping and all, its circulation, everything can be done properly. So in these people who are having these heart complaints, what usually happens is if the heart is not able to pump properly, it can result in a backward flow, resulting, if we think in PM level, can result in a pulmonary edema. And obviously, when they are going to lie down, they won't be able to take a breath. there will be a paroxysmal nocturnal dyspnea, what we say, when the person is lying down, because now when the person is lying down, the blood flow from the extremities will be highly efficient towards the heart region. So the blood will be returning to the heart region when the person is lying down, because lying down, the level of the leg is getting equal to that of the chest region. So the blood will be coming, the venous return will be very effective. And then when all this fluid is accumulating in the heart region and the heart is not able to function properly because it's already having some or the other pathological condition. Now you name it myocarditis or any other valve disorder, whatever, the heart is having some problem with its functioning, that is circulation or pumping of the blood. So when that happens, the fluid is getting accumulated in the chest region, so the person won't be able to take breath properly. He will have to, with a difficulty to take breath, he will be suddenly waking up from his sleep with a gasping breath, and then he will sit to take a breath actually. So those symptoms, and that is because of the failing heart. So when we are giving this medicine, Cratageus, in a long duration as a heart tonic, this problem, the heart will be starting to function normally, and then the person will be having a good sleep. That is the meaning of sedative over here, not like the other sedative in the allopathic sense, that you give the medicine today and today itself the patient is going to sleep peacefully, or like even our passiflora or a coffee, our coffee, it is not going to be an acute one. This is a sedative in a long run. So chronic heart disease, where the muscles seem flabby, worn out, or the hypertrophic condition, heart dilated, and the first sound is very weak. It's just the clinical symptoms. It doesn't matter whether you can remember or not. Only those which I have colored, remember in the exam, write only those things. There will be cardiac dropsy, fatty degeneration of the heart, or the fat being getting deposited, extreme dyspnea on least exertion. The pulse may be accelerated, feeble, irregular, intermittent, can be varying. And because there is no circulation that is properly possible, usually the extremities will be cold and also pallor will be the. And they're saying also about angina, but I didn't put any color. There is a painful sensation of pressure in left side of chest below the clavicle, indicating the angina. However, in an acute angina, as I told, Cratageus wouldn't be of much help. So, arteriosclerosis is said to have, as I told, a solvent power upon crustaceous and calcareous deposits in arteries. And in the beginning of heart mischief, that's a term used in Boric, so I just copied the same thing. But in the beginning of heart complaints, especially after rheumatism. So the rheumatic heart complaints or after to rheumatic fever, the heart diseases generating from that rheumatic heart diseases, we can think about Cratageus. So after infectious diseases, this Cratageus, if given, it can help to sustain the functioning of heart, or we can prevent heart complaints after two infectious diseases. So if we could find out a patient is having a rheumatic fever, and it is possible by diagnosis, of course, we'll get the lab report and we can understand if it is a rheumatic fever. If we give Cratageus beforehand, it is told that it can prevent or it can sustain the health of the heart. So when we go for the symptomatology in total, in case of Cratageus, the most important one, it is a good remedy for high BP as a heart tonic, and it can be like for cardiac dropsy, then the cold extremities, then this one as a sedative, but remember how it is becoming a sedative, and most importantly will be these two sentences, and out of it, if you have wrote Cratageus and this green sentence is not the, you won't get the complete mark. This is the main important sentence, the indication actually, having that solving power or the dissolving the crustaceous or the calcareous deposits in arteries, which means the arteriosclerotic, the plaques, what you have learned in TM pathology, and that plaque deposition in the blood vessels, they will be Cratageus has got the ability to dissolve that. So it is worse in a warm room, better in fresh air, quiet and rest. Relationship to Strophanthus, Digitalis, Iberis, Naja and Cactus. In case of Digitalis, Strophanthus I have to refer, but in case of Digitalis, it will be usually low pulse. The pulse will be intermittent and it will be missing and it will be very slow pulse in case of Digitalis to be given. And there is a sensation as if the person, in case of Digitalis, if they are moving, the heart will stop. So they will prevent or they don't move that much. So that's how Digitalis can be differentiated. Iberis also I have to refer. In case of Naja, this is also another remedy in case of rheumatic heart disease. As like we told in case of Cratageus, Naja is also specifically for the rheumatic heart disease after to the streptococci. And also in case of specifically Naja, the edema will be characteristic. In case of Naja, Naja is one of the remedy in which more than the hemorrhage, generally all the Ophidian remedies we have the hemorrhage to be characteristic, but Naja is one of the remedy in which edema is highly characteristic. Another Ophidian remedy will be elapse actually, where the edema is highly characteristic. So in case of Naja also, the heart complaint, which is after to the rheumatic fever, that is more characteristic. And cactus, the characteristic pain should be there. And in case of Strophanthus and Iberis, have you learned Strophanthus and Iberis? Even know its features?
No. Not me.
Even I have to refer Strophanthus. So these features we just study for the exam actually. So Strophanthus is more indicated in case of if the heart is having palpitation. It is a good remedy, Strophanthus, to reduce that palpitation. And it is also good for irritable heart of tobacco smokers. Irritable heart of tobacco smokers. But we have another remedy for that. Irritable heart of tobacco smokers. One is tobacco and another one is phosphorus actually. But both of it we can give only as a this one constitutional of the high potency, not as a tincture. Then this can also be given for arteriosclerotic conditions. And Iberis. I'm not typing that because it is not in your syllabus. Okay, you want me to type?
Yes, please, miss. I think that would be helpful.
The spelling of tobacco. Then after you study this for your exam, okay. I'm not going to ask you about the syllabus. This will be the indication. And in case of Cratageus, actually is somatic disease, okay. They have a particular vocal irritation of cough, the dry irritating cough. It is related to this heart complaint. Have you known cactus? The typical angina condition where you feel the heart has been uh, twisted in a vice-like manner.
Miss, what's a vice-like manner?
Um, when you did your +2, did you choose something called as in your physics lab something with what is that? Oh, I even forgot that thing. Uh, Vena, do you remember? It's like a it's like an instrument actually. It's like an instrument which we will tighten actually to the smallest level. I just caliper something I remember. It's actually the voice like manner. I feel like or imagine something that is uh, 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 the thing is called as screwdriver, not the screwdriver, spanner. Yeah, something like spanner. Do you understand when I say what is spanner?
A hammer?
Spanner. SPANNER, a spanner.
Oh, spanner. Okay, okay, okay.
Yeah. So imagine like your heart has been kept, somehow squeezed inside that small gap of spanner, and the spanner is being twisted and twisted apart.
Oh,
That is
okay.
the vice-like manner. So, like a span, that is the sensation. So, the patient will be having a sensation as if the heart is being crushed, it is being twisted, it is being turned, and that is the common symptom. How a patient feels when he has that pain of heart attack, or that MI, what we say when we say that typical angina. Angina, it is not the feature of cactus actually. When we proved cactus, we got that pain actually. But the pain, how the patient explains is very similar to the exact explanation of the pain angina patient will be feeling. That's as if someone has grasped his heart and has been twisted. So crushing type of pain. So the typical painful angina condition we meet in case of cactus.
Okay. Thank you.
Then it was Iberis. Iberis I have to refer. When we go for these tinctures, it's very difficult to find out a characteristic feature. Even I never understood. Though I studied for MD, all this by heart I have studied and wrote in the exams and rarely practiced with tinctures, and I never understood actually. When we take the verdict, it is all similar symptoms. How do they differentiate? Like Cratageus, one symptom, yeah. Other than that, how it is possible to differentiate which tincture to be given? Never understood. And they are having almost similar symptoms. So all I'm saying it will be for tachycardia. Picture over here, cardiac. Yeah. Like digitalis, this is also having heart complaints with liver affections and also white stools. This is similar to that of digitalis. But then I never had really understood how people differentiate these with the similar features. That's why other than for exams, I will never say you to do this in your practice unless you get a clear direction how it is being differentiated, because the same complaints, the heart complaints, liver affections and white stool we can get in digitalis also, but in digitalis, yeah, it is not the tachycardia, it is the bradycardia over the. That's really I will advise. Anyway, the dosage will be, it is given as tincture 1 to 15 drops, must be used for some time in order to obtain good results in case of our the remedy Cratageus. Then the next one is Crocus sativus. Do people want a small break?
Yes.
Yes.
Okay. And so we'll come after 10-15 minutes. 3:40?
Can.
Okay.
Okay, are you all there? Can we continue?
Yes.
Yes.
So next is Crocus sativus. This is a medicine from the very costly or the expensive plant, the saffron. Natural odor is iridaceae, and the pot used that tincture of dried stigma. And you know why crocus is usually prescribed for? Anything about crocus?
Dark stringy hemorrhage.
Yeah, hemorrhage is there. So anything related to hemorrhage. So in case of dysmenorrhea, meteorrhagia, menorrhagia, and of course when we say hemorrhage, we have to mention about its characteristic feature. And here the characteristic feature will be like a, I mean, we'll go through it. It will be very dark red color bleeding. And like what we say in case of calibicromicum, it's not actually the blood we are saying, but when we say about calibicromicum, the nasal discharge, we say that the discharge is very viscid, and when we are trying to draw it out, it will come in long strings. That is about the nasal discharge we say in calibicromicum. But similar, if it is happening in case of um, bleeding surfaces or the uh, uh, menstrual blood also like hanging like a it will be clotted also and also hanging like thread, the dark one, then we call it as a I mean we can give crocus sativus, and another will be bovis third is having the same feature. So hemorrhage is one feature, one characteristic. Anything else? So yeah, menorrhagia, dysmenorrhea, even for abortion, this can be a very effective threatened abortion. And anything else? It was good for hysterical condition also when the lady is hysterical. And generally, if you go through our medicines, you can see that if a medicine is having a action constitutionally, okay, not like a small, really small remedy, but a constitutional action upon dysmenorrhea, menorrhagia, metorrhagia, abortion, uterus-related complaint, then definitely they will be having hysteria also. So initially in those centuries, they used to connect uterine troubles with the mental, the mood swings the female used to have, or that hysterical nature. They used to connect it with the menstrual or the female uterine complaints. So they are having some hysterical complaints also. So when we go to the clinical conditions, there is abortion, the threatened abortion, menstruation profuse, for the cancer, metorrhagia, menorrhagia, or anything. So this is the plant, and this is the stigma that we use. So this is, I mean, I don't know, this is the exact thing that what we use for when we are making some desserts to make it, we get a slight reddish color and also a nice flavor. We use this stigma. I hope you understood what is this plant. Did you all understand?
Yes, miss.
Okay. And I don't know whether you know, in India, because we majority of us are brown and dark skinned. Dark skinned, okay, no, now brown skinned. It's a usual tendency for the pregnant women to have one glass of milk every day uh, mm, with this saffron uh, put in that, and it is believed, I don't know how much true it is, okay. I don't have any clinical verification or even what I witnessed. Uh, they take this milk with this saffron string in that, with the belief that it will, even if the baby is dark, if they take this milk, the saffron milk, the baby born will be fair in complexion.
Okay, such a belief they have. However, they don't take it. I don't know whether people, I mean, those my grandpa, people who are grandfathers or even before, they knew it or not, I don't know. But usually, this is not given in the initial trimester. The first trimester, they don't give it. That practice is usually happening starting from the second or the mid of the second trimester. From 5th month onwards, only they give that. And maybe someone told that it is empirical actually. So by observation, they might have noticed. I'm not sure, but the scientific explanation, what we could give that initial months it is not given. If the baby has to be born fair, they could give from the starting also, no. But this medicine, as we learn over here, this if it is can be given for threatened abortion, of course, this can result in a proper abortion also. So that is why there's a scientific explanation why this is not given in the initial months of the pregnancy, but always towards the 5th month only they are giving this one. So mainly, Crocus has got 3 important characteristic feature. So the first one is with the hemorrhage. It can happen from any part, from the nose, uterus, or any other part, anus, the mouth, anywhere. But the feature should be the blood is black, viscid, clotting, and when it is drawn, it should be drawn into long black strings hanging from the bleeding orifice. So such a symptom we can see in case of relapse, one of the snake remedy, and also in case of bovista. Then another one is that is, I mean, two, Crotalus horridus and cyclamen, but that is mainly they are dark and clotted, but not that it can be drawn into black strings. This black strings, the feature is of Laps bovista uh, and uh, Crocus sativus. The second feature is a particular sensation as if something is alive or moving about in the abdomen. And this sensation, something alive and moving about, the most common remedy you would have seen is thuja and sulfur. So this may be a definite sensation or it may be a hallucination or a fixed idea. The medicine that we see are thuja and sulfur, and this condition technically or medically we can call it as pseudocysis. And pseudocysis can be like the lady is feeling that she is pregnant. She is not actually pregnant, but she is feeling that she is pregnant. So this has been a case that has mentioned in J.H. Clark that Crocus has been often successfully given to pregnant women who have complained of violent fetal movements as well as in case of imaginary pregnancy. So in both conditions, like what they say is that the sensation as if something alive is moving about in the abdomen. So it can be a real sensation where there is a excessive movement of the fetus inside the abdomen, or it can be a pseudocysis when there is no baby, but still the lady is feeling like she is pregnant. So whatever, whether it is originally an increased movement of the baby or a sensation or a hallucination of the non-pregnant women, both can be covered using Crocus. And another important feature is the rapid alternation of the mental symptoms. That is, I told you there is hysteria. So what we learn in case of ignatia, laxis, lac caninum, lilium tigrinum. So like that, those remedies, there will be sudden change of emotions. From sudden sadness, she will go into a stage of hilarity, or from happiness, she'll be coming to sudden anger or sadness. So such alternation of mood is very characteristic. So these are the 3 important features in case of Crocus sativus in a nutshell. The hemorrhage, where the blood is very black viscid and it can be drawn into long black strings hanging from the orifice. Then sensation as if something is violently moving inside the abdomen. And it can be either an imaginary situation or pseudocyesis or a violent fetal movements also. And then the rapid alternation. And there is uncontrollable laughter or hysterical laughter. The lady is having sensitivity to music, involuntarily joins on hearing anyone sing. Not that important, but this one is important. It is called as a kissing remedy. The lady will be very happy, affectionate, and wants to kiss everybody. So that is when we were students, we were studying like this. We used to say it as a kissing remedy. So that is Crocus sativus, only when she's in a good mood. Okay. Then some other vague sensations are there, like stitching, shocking, pain, throbbing, cutting, jerking. You don't have to remember various kinds of sensations just because we can relate it to the hysterical nature of that lady. Then there is twitching, or what we say this chorea, no, the twitching itself, the muscle twitching of single sets of muscles. And that one we have ignatia, agaricus, and another one will be zingamet. Then scarlet redness of the whole body or scarlet spots on skin, not that important, though it is saying it is a domestic remedy for bringing out the eruption of measles. Homeopathically, it is not that much common. And in case there is painful separation of bruised part, old cicatrice wound reopen and separate. That what we learn in causticum and graphitis. It is also seen in crocus. However, even if you forget this symptom, it doesn't matter because our two important remedies for this condition will be causticum and graphitis. Then lipoma and encephaloma of scalp, tumors with ulceration and characteristic bleeding. Cancerous condition also only if that characteristic bleeding is there, that indicating feature is there, we can think about it, otherwise no. So constitution, it is specially suited to women, or men, but should be hysterical in nature. And headache is very characteristic, especially they have during climacteric or menstrual flow. And in menstrual flow, it is aggravated during 2 or 3 days of existent menstrual flow. And this headache can also be seen before 2 menses, can be seen during menses and also after flow. So this is characteristically called as a menstrual headache, which is related to menses. So immediately before menses, during menses, and immediately after, there will be headache. But another important symptom will be in their eyes. They will be having a sensation as if room is filled with smoke. This is actually a sensation as if they had been weeping, as of cold wind blowing across the eyes, and closing lids tightly gives amelioration. So like always the eyes is watery and suffused in, and if it is feel that they feel like the cold air has been going directly through their eyes. So some weird sensations is if they have with their eyes, that the room is always filled with smoke or they had been weeping. This is more of a good remedy as a crocus sativus, but I don't have any clinical experience and I have not seen anyone giving crocus sativus for this complaint. But what I have seen is why I stress upon this is usually this sentence can be asked as an MCQ. Because such a characteristic feature with the eyes, the sensation, and also the room filled with smoke, as if the lady has been weeping. This symptom is unique feature of crocus. So in an MCQ basis, I have seen this sentence to be important, but clinically, I have not given.
Have anyone of you given this remedy or heard being given this remedy for such a complaint?
No, no, rarely used.
Yeah, it is because it is usually connected with that hysterical nature when a woman is feeling that it is a strange sensation. And we saw that they are having a lot of strange sensations, that abdominal movements also. So it is mostly related to the hysteria, the strange sensation that which we are saying about this one. And it knows the characteristic feature of what I told you, because we already saw that hemorrhage can happen from any part of the body, but the feature will be should be black in nature, viscid or tenacious. That means it is sticking onto the part where it is happening, and when we are trying to remove it, it won't come out completely as like that, but it should be it will be drawn out in strings. Another feature will be cold sweat in large drops on forehead. And cold sweat, we can go for camphor, veratrum alb, calcarea, silicea for that matter. Then for mouth, there is great thirst for cold drinks. It doesn't matter. Directly to the female reproductive system, the same thing. That is dysmenorrhea, the characteristic blood bleeding nature. And the one remedy will be a stillago. And this one also we told that as if something is alive in the abdomen and it is moving. And along with that, there is nausea and faintness. When I say you that, there is a symptom the fetus inside is making somersault. And there is fetus actually, okay? There is no sensation. You know which is the remedy? Excessive somersault. Somersault, it will be like moving up, down, like that. We have a remedy, but I don't know how much it will be working over there.
Murex?
Not Murex. It's very unexpected remedy. It is lycopodium actually. And in case of Sorinum, there also there can be this violent motion, but that violent motion is leading to very severe morning sickness. Then we can think about Sorinum. But this is so all these medicines, they have that something alive in the abdomen, the tuja, sulfur, and lycopodium. It is the baby's the excessive movement of the somersaulting of the baby. We can give lycopodium, or that is a feature of lycopodium. And this excessive movement itself, not a sensation, actual baby is there, and that leading to excessive nausea. Another constitutional remedy could be Sorinum, or miasmatic remedy could be Sorinum. Then modalities, the aggravations, it is happening during fasting, during new moon and full moon, pregnancy, hot room, hot weather, amelioration after breakfast, yawning in open air, whatever you remember. But this one that which I have underlined, for exam purpose, at least remember that the medicine which is having aggravation during fasting and amelioration by breakfast. Nux pulsatilla or sulfur follow Crocus well in nearly all complaints, and then that you can connect it to the hysterical nature and the uterine complaints. You can connect everything, that similarity. Then the last medicine for today is actually Eupatorium perfoliatum. Eupatorium you should be knowing, right? Very common remedy. Most of you might have already prescribed also. So what is Eupatorium perfoliatum?
Influenza.
Influenza, yes.
Dengue.
Huh?
Dengue.
Dengue, yes, dengue fever. So the feature will be that extreme bond pains, be it influenza or dengue fever, that extreme bond pains should be present, and that is the characteristic feature of Eupatorium perfoliatum. Even its common name, you can see it is bone set. So that is why dengue also we call it as a break bone fever, or the fever which is characterized by the bone, the pain as if the bone is getting broken off. So that much severe type of pain. That should be the characteristic. So belonging to the family Compositae, and tincture used is the whole plant. Oh, I forgot to copy paste the picture from the other one. Please give me a second. I open. So this is Eupatorium perfoliatum. Clinically, as we told, for dengue, influenza, simple rheumatism, and soreness of liver or any other part. The soreness, as we say, as characteristic like in arnica, if we get that. So the leading characteristic for its homeopathic use is the distressing bone pain found in connection with malarial fever, influenza, dengue, or whatever intermittent fever or any type of fever. That characteristic bone pain should be the soreness will be found running throughout the proving, like that what we say in case of arnica. So in case some examples that have been given from J.H. Clark, that which they got during proving. In case of headache, and headache is also a highly characteristic feature of Eupatorium. So in case of headache, there is soreness internally, even the parietal protuberance. Over here, it will be very sore to touch. Then pain and soreness in the eyeball. And this is another feature of dengue fever actually. In case of dengue fever, one of the common feature, what we say is retroorbital pain, or pain behind to the orbit, the eye orbit. So that is also one of the therapeutic feature, or that what we got in the proving of Eupatorium. So there is pain and soreness in eyeball. Just note it down. In dengue fever, it's only saying retroorbital pain, the pain behind the orbit, eye orbit. But in proving the symptomatology of Eupatorium, it indicates that it is not just a pain, but a soreness over there. So that sensation is specifically coming in case of Eupatorium. Then there is cough with extreme soreness down trachea, also in the soreness of chest, and aching pain in limbs and throughout the body. So this headache and soreness, and also that break bone, that intensive pain in the bones as if it is breaking, that are the two important features of Eupatorium. Stiffness and general soreness, either this is not important. So once again going, the bone pains, it can affect back, head, chest, limb, especially the wrist as if it is dislocated. So mostly the small joints are usually will be affected. The more general and severe, the better adapted. So the more severe it has gone, and more if the pain is not concentrated in one particular area or the specific part of the body, but whole of the body, and it is very severe, that much indicated the remedy will be. Bone pains of all descriptions appear under Eupatorium perfoliatum. They cannot lie on bed on account of a feeling as if every bone was bruised, causing despair, mourning, and crying out. And after this thing, something that you have to remember for the exam purpose and also the clinical, the pain comes quickly and go away quickly, as like a lightning type of pain. What we say other remedies, it will be belladonna, magnesium force, and this is Eupatorium perfoliatum we are learning, but there is Eupatorium purpureum also. So in those remedies also, the pain come quickly and go away quickly. That is Eupatorium pain. And there is sensation of vertigo as if the patient is falling to the left. And clinically, I'm not sure how much this is important, but this is also in case important like a MCQ. Because this is one of the remedy. I mean, it's a unique remedy that the patient is having a sensation to fall to the left when he is having vertigo, which is a characteristic feature of eupatorium. The liver is strongly affected in case of eupatorium. There will be bilious vomiting and diarrhea or bilious sick headache, cough arising from irritation of liver. So when we go for this symptom, we have mentioned about the soreness, and we have mentioned about the bone pains that is being very characteristic. And now we are mentioning about the bile affections, or in case of liver affections, so bilious vomiting and diarrhea with fever. Do you any other medicine is coming to your mind which is so common? Whether it is soreness, whether it is bone pain, we don't go for bone pain per se, but still bone pain and bilious vomiting or liver affections. A very common remedy. Come on, don't think too much. You all know that remedy.
Bryonia.
Yeah, it is bryonia. But bryonia and this one, eupatorium, one of the characteristic difference will be in case of sweat actually. In case of bryonia, what we see is the person is extremely dry, there will be scanty sweat. But in case of eupatorium, both are possible. There can be scanty sweat and there may be also profuse sweat. So both things are possible over there. But it is also, Kent has also drawn out like in the initial stage of an intermittent fever, when this headache, the soreness, the bone pain, everything is so characteristic, we give eupatorium. But when it goes into a more complicated level where the bile vomiting we say even in case of eupatorium, but when it goes to that extreme level, where the discharge, that color is changing, at that time, as a follow-up of this one eupatorium, bryonia could be given. That's how Kent draws out. So after 2, eupatorium. Catarrhal symptoms are very prominent. There is loose cough, especially at night, hoarseness with aching, soreness of trachea. That these symptoms we have already seen in their proving, with scraping in bronchia. Like over here, we have mentioned the cough with extreme soreness, brown trachea, soreness of chest. So that is what something that we got during proving also. So this is a feature. And when the patient is having this extreme cough with that soreness in the chest region, the patient is compelled to hold the chest with his hands. This we can see in case of bryonia also. They will be holding their chest like this because of that extreme pain and that soreness they feel by that continuous vomiting. Continuous coughing. And then kneeling with face towards pillow, it ameliorates the cough. This is the characteristic posture they have when they do have this cough. So, or the cough is ameliorated by getting on hands and knees, such a position. That will be giving an amelioration for cough in case of eupatorium. Can be sleepiness and yawning, which is not that characteristic. And then in case of constitution, it is not important actually.
But this is usually given for diseases of old people, the worn out constitution, people who are having cachexia from prolonged or frequent attacks of bilious or intermittent fevers, especially from inebriety. You know what is the meaning of inebriety?
No, miss.
Alcoholism, chronic alcoholism. For that, in homeopathy, in our Materia Medica, they use the term inebriety. So now you can connect the symptoms actually with bryonia and how bryonia is coming over here after to eupatorium. So people, I'm not saying about a acute fever, dengue fever, a patient is coming, then we are going for alcoholism. No, not like that. But in cases like this frequent bilious or intermittent fever, like malaria, or any other fever that is affecting the liver actually. Uh, if it is coming like a chronic or continuous effects, it can later lead into some complications with liver. So that leading to some liver cancer or something, or even liver that is getting affected due to excessive alcoholism, and that resulting in a worn out constitution. If we are going to the constitution, as I told, not in an acute dengue fever you're going to see the constitution, no, but in if we get such a history, like the people, the old people, the worn out constitution, maybe in the young age they were alcoholic and the repeated alcoholism have resulted in the repeated bilious fever or something that is related to the liver complaints, or the repeated attack of malaria, or any fever, and that any fever means any fever that which affects the liver, and that have resulted in a cachectic condition, then that is the constitution where eupatorium is indicated. But usually when we are prescribing, as you already told, we think about it only in acute conditions, like influenza or the not the rheumatism, this one, dengue fever. We generally don't go for the constitution, but don't forget this sentence, because this can be asked like a MCQ. So in MCQ, usually the sentences which are unique for that drug and also which we are not going to remember, that is usually asked. So this constitution of eupatorium, you may be studying about all the features of eupatorium, the extreme bone pain, the soreness associated, then the cough that is having, the headache of the patient, and the sensation as if he's falling to the left, and that he has to hold the chest during cough because of that soreness and that particular position. But obviously, but for sure, if I have not stressed upon this, you are never going to study about what is the constitution of eupatorium. So those things. But this one, if you read for other remedies, you may not be getting this exact symptoms. I mean, you can get somewhat some similarity. Diseases of old people, we can get a lot of remedies like lycopodium, Baraita cup, conium, uh, Baraita moor, then Cali group. We can think like that. Worn out constitutions, we can go along this with remedies. We can go for Sikale, and then Sarsaparilla, Selenium. And then inebriety becomes, then we have another set of remedies like Syphilinum, Tuberculinum, Sorvinum, sulfuric acid, then Asarum. So another set of remedies comes over the cachexia, all the syphilitic, mercurius type of remedies we can think over the. But all these things coming together, and when we go through the options, we see eupatorium. If I have not stressed upon, you are never going to think about eupatorium. You will be going for all the other remedies that which I put. So for that purpose, even if not clinically important, for the MCQ purpose, do remember. But now I'm not going to ask you this question after explaining this much, but I'm just stressing upon why you need to remember the constitution of those remedies, especially those things which you don't give much importance to.
Then once again, the intermittent fever, I think it is mostly the repetition actually. Intermittent fever, when we say, we start with the different stages, the chill stage, heat stage, the sweat stage, etc. So in case of chills, it begins in the small of the back in case of Eupatorium perfoliatum, with aching soreness in the limb, as though every bone in the body were being broken. The chill will be attended with nausea and vomiting of bile. The chill is nearly always in the morning and is preceded by several hours by thirst, soreness, and aching. And this feature, the thirst, with which is there during the chill stage, because the thirst will be usually present during a heat stage when the person is extremely having heat, or the sweat stage when the patient is dehydrating. They will have a thirst at that time. That is very common. We can associate it with the common pathological symptoms. But to have thirst during chill stage, when the patient is actually having so much shivering, we are not expecting the patient to feel that thirst. But in case of Eupatorium, they have that thirst during chill. Then there can be the fever stage. In the fever stage or the heat stage, there will be increase of that pain, the soreness or the pain in the bones that will be aggravated. Um, all these symptoms that we mentioned above, it will be all these pain, the soreness, the aching of the bones, etc. It will continue during the heat stage also, especially vomiting, which will be very painful and incessant. And this high fever will be followed by sweat. Sweat, let's say it is scanty or profuse, and that sweat will be ameliorating all pains except headache. Headache will be getting aggravated by this sweat. The periodicity is very marked. If the chill is usually morning one day, it will be evening the next. As we have already seen, this is a medicine that can be indicated in malaria, and in malaria also there is cotton, then different type of cyclists, tertian, quotidian, like periodicity is there. Bryonia is the closest analog, but bryonia has free sweat and the pain make the patient keep still. Oh, I told it in opposite, right? Yeah. Bryonia is actually, bryonia, though we say it is a dry patient, this was something that I saw very contradictory actually. It was actually said by Kent. Because when we refer bryonia, what we almost say is bryonia is actually a very dry person, extremely, I mean, not very less sweat also, scanty sweat. That's what we say. Even his skin, mucous membrane, everything is dry. That is why they even have that sinusitis type of headache, because the discharge have got dried up over there. It is not coming down and staying over there. It is creating the sinusitis pain. And even constipation becomes highly characteristic in case of bryonia, because the mucous membrane have got dried. So that is the kind of bryonia, the impression we have, a completely dried up person, not constitutionally, but the sweat. The person will be rarely perspiring in case of bryonia. But when we take Kent, we see Kent is presenting a feature of bryonia, which we don't get to see in Allen's or also in Poric. Kent says the bryonia is actually having excessive perspiration. So that is how Kent is differentiating Eupatorium and bryonia. So according to Kent, bryonia is having free sweat, and also the pain make the patient keep still. So we always say movement is absolute contraindication in case of bryonia. Bryonia needs that absolute rest. The slightest movement is going to increase their pain, aggravate their complaint. But in case of Eupatorium perfoliatum, they are having scanty sweat. And this is, I still repeat, this is a concept of actually of Kent. I mean, in Kent's Materia Medicalia, I have seen that. And its pain cause actually restlessness. And the Eupatorium perfoliatum, actually, they will be tossing about in the bed because of that pain. So in case of bryonia and Eupatorium, Eupatorium will be having scanty sweat and free or excessive profuse sweat in case of bryonia. And bryonia, they will be having amelioration by rest. However, in eupatorium, the person will be extremely restlessness. This is how Kent has differentiated. I'm just mentioning the name Kent over there. Then this is an important relationship as well. Because it is intermittent fever we are mentioning about, the periodicity become highly characteristic. The compatible medicines or follow-up, we can also say, not just compatible, as a follow-up, Natramur and Sepia is considered very good for intermittent fever after 2 eupatorium. So that is all for today. Is there anything else that we can discuss about the drugs? Any cases you want to say? Any experience? Then you might be having some experiences with eupatorium, right? Nine.
Yes.
Yeah, can you say some experiences, because our little Farah is also there, so it will be very helpful for her also.
Experience.
Anyone? I just called out Nine's name, but anyone?
Yes, please. Thank you. I would appreciate that.
In case of eupatorium Farah, I can say one of my not clinical experience actually. It was not remaining in the clinical. We could say a community trial, but not a trial also. When I was doing first BHMS, yes, first BHMS, 1 or 2 months after joining, that was in the year 2002. Okay, so at that time there was chikungunya, which got so epidemic in Kerala. The whole, not dengue, it was chikungunya actually. So whole state came to a standstill, we can say, but it was limited to Kerala only. Okay, it didn't go to outside Kerala, luckily. So there were so many chikungunya patients were there. Every time, I mean, a lot of patients were there. And then the genus epidemicus that was decided was eupatorium. So for about 1.5 months after my joining, for us the semester it is not semester. We have the annual exam after each year, but then we have first semester exam, second semester exam, like that. Only the internals will be taken, and internals will be considered for the final university exam. So anyway, so we have this semester also, but that is not official. Anyway, so 1 or 2 months we had classes. After that 1.5 months we didn't have classes. What we used to do was we used to go to college and then sit for medication. There will be I mean, for 1.5 months, just imagine 1.5 months, every day from morning 9 to 5, our only job was to medicate the globules and fill the bottles and make it full, because each association used to come to us, to the college. So still, even if we are doing this much, our medicines were going only in that district of Trivandrum and the nearby district, that is Kollam. The whole Kerala was affected. But then there were 5 medical colleges, homeo medical colleges in total in Kerala. So 2 were the no, at that time it was only 1. Now only another one started. So 1 was there in the southern tip. In the middle there were 2 colleges, and in the northern part, 2, 3, very good. Yeah, 1 college. So yeah, at that time it was only 4. Later only 1 another joined. So these 4 colleges was distributing the medicine. So classes was suspended. We were just giving the medicine, and at that time even the health system, the government of Kerala also supported a lot, because as like COVID, There was no particular medication that allopats had for this chikungunya. Chikungunya was also at that time came like an epidemic, and it was the first outbreak, we could say, that happened in Kerala in my memory. Okay, before to that, years before had it happened, I don't know. It was the first time chikungunya came to Kerala, and all the people got so panicked. Not like that in COVID, because people were of course not dying because of chikungunya, but they had that extreme bone pains, especially of the small joints, and eupatorium was given, and we were able to control the condition a lot. And after two few days, people stopped taking even allopathic medication. They used to go to either the homeopathic hospital or to the homeopathic doctors to get these medicines. And the people who didn't have, they were taking preventive medicines, according to the resident association used to keep our camps. So homeopathic medicines were widely used. I mean, not all, only eupatorium perfoliatum. And we used to joke among ourselves at that time, will we be having the proving of eupatorium? Because we are inspiring that area continuously for 1.5 months. But I don't know, but no, none of us, it never came in our college. Maybe one or two cases, I don't remember. Not the patients. Among students, I don't remember. But yeah, that epidemic we controlled using Eupatorium perfoliatum. It is very efficient in controlling this one. At that time, maybe it was 2002, and it was restricted within Kerala only. It didn't go outside Kerala. It didn't become a pandemic. And the allopathic system was also, or even the social media was also not that common. Not that common means I don't think at that time in 2002 in India there was even the smartphones. No, even the normal phones, the Nokia phones was not there. It was in 2003 or 2004, and that only 1 or 2% in my class, the high, extremely rich among us, they had the Nokia phones. The smartphones came still later, so there was no controlling. Like now, when the COVID-19 came, and when we are ready with our genus epidemicus, like the RSAL, we had a lot of restriction from the social media worldwide, how our medicines can be given. There is no treatment. There is then homeopathy comes up with some prevention, blah, 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 blah. A lot of um, problem they had against us. But at that time, this time in 2002, when the social media was not that accessible, or even internet was not heard at that time, we did a lot of things with Eupatorium. That is highly effective. That is one of my memory with Eupatorium. And all the other remedies in this that I have discussed, I have seen corallium. I have never prescribed corallium directly, but I have seen corallium being prescribed by my professor for a cough similar to whooping cough. It was not whooping cough actually, because whooping cough, its incidence is very less now because of the vaccination that is being given. But the continuous cough, corallium rubrum was given. Because it was acute complaint, it also passed off. Then crocus, I have never seen given to anyone. Okay, and never seen anyone being given crocus. Then what was the other remedies? Collin as a tincture, I have seen for the heart complaint and the hemorrhoids. Some of the teachers prescribing Collin. And Condurango, we in our hospital where I studied, we towards my end of BHMS, I think they started a palliative care, a cancer palliative ward actually in the hospital. We, because it is a palliative type of treatment, already these cancer patients have taken the treatment for the cancer, all the chemo and the radiotherapy had been taken. And then still when they are in the end stage, the family wants to do something for them, but allopathic treatment, they are never going to take them for them. These people are already in the terminal stage. So we used to have many patients in the palliative ward. So I have seen that, and now I'm not seeing the curation of the cancer by Condurango, but I've seen Condurango being prescribed for that excessive pain and for a slight palliative
care only. I mean, only the palliation was being done, not that the complete cure of cancer. No, I have not seen. So these are my experiences with these drugs. Anyone want to add into anything? No. So can we stop?
Yeah.
So stop. Recording has started. Stop recording. Have you